Assalamualaikum and salam sejahtera to everybody. So we continue our dermatology class today with fungal infection. My slides actually contain two parts, which is fungal infection and viral infection. However, I think I know that viral infection has been covered by another lecturer. So I just cover the fungal infection. So there are three learning outcomes for this lecture. It's just a simple lecture. You don't need to worry too much. Basically, you need to know different types of fungal infection with the different features and discuss the management of fungal infection. So for fungal infection also known as yeast infection. No, fungal infection have uh, three types. Yeast infection as part of fungal infection. So yeast, for example, is Candida, Malassezia. I think today one of your friends mentioned about Malassezia in the management of seborrheic dermatitis. I remember the hair infection of the scalp. And then you have dermatophyte infection. Basically, dermatophyte infection is also known as fungal infection, as well as deep fungal infection. So, what are the risk factors for fungal infection? Fungal infection is very effective, in which you can get fungal infection from sharing clothes or overcrowding, excessive sweat, as well as if you have suppressed immune system. For example, if you have diabetes or HIV or prolonged use of steroids. So basically, when you suspect fungal infection, these are the questions that you need to have in the history taking. Whether you have history of sharing clothes, whether you are staying in overcrowded places, whether you have diabetes or any other causes of immunosuppressive disease. So just like dermatitis, dermatophyte infections name are given based on the site of fungal infection. In dermatitis, the name of the dermatitis is based on the types of dermatitis. So fungal infection is even easier. So if it is fungal infection of the trunk and limbs, you call it as tinea corporis. In the groin, tinea cruris. In the scalp, tinea capitis. In the foot, tinea pedis. Of the beard, tinea barbi. Of the face is tinea fasciae. Of the hand, manium. Nail infection, anguium. And then you have deep fungal infection, which is fungal abscess, and it's called carrion. You also have tinea incognito. And then the other one is sporotrichosis, or deep fungal infection. Sorry, carrion is fungal abscess, not deep fungal infection. So the diagnosis is similar to other skin problems, which is skin scraping, as well as microscopic examination. So first is tinea corporis. This is among the common ones. Usually is an acute, can be sudden onset with rapid spread. The typical feature is it is itchy, inflamed red patches, sometimes can be pustular, and you can get it from the animal. It can also be a chronic tinea corporis infection in which you have slow extension of a mild, barely inflamed rash. and it is most prominent in the body folds. For example, in the axilla, in the groin, under the breast. So these are the common places where you can get this slow chronic fungal infection in the body. So these are the features of tinea corporis. Tinea infection. So it is itchy, and the shape, you have typical shape of either circular or oval. It is erythematous. But another typical feature is that you have this scale or patch which spreads centrifugal, in which starts here spreading outward with central clearing, raised border. Okay. Sometimes multiple plaques may coalesce, I mean combine, and sometimes you can see pustules. So it's circular, oval. This is a typical feature. And you have a feature, a ring-like feature. Sometimes it is called ringworm infection. Ringworm-like infection. Okay, it's like a ring, erythematous border, raised scales, raised border with scales, and patch of plaques, central clearing. So if you see a rash with this feature, think about fungal infection. So this is tinea corporis, multiple rings which has coalesced, combined together, and you can see a ring, a raised border. Sometimes you can have pustules, and you have central clearing. So this is a feature of tinea corporis. And then you have tinea cruris in the inguinal creases in the groin. So it extends distally from proximal to distal, and then especially in the thigh and groin, and proximally towards the abdomen. So it can infect the groin area, extending to the limbs, as well as extending towards the abdomen. Okay, this is tinea capitis. Tinea capitis usually is associated with alopecia. It is itchy. Sometimes you can have cervical lymphadenopathy. And the typical feature of the hair loss is called moth-eaten hair loss. It's like being eaten by an insect. Moth is an insect, like that. Patches of alopecia. And sometimes tinea capitis can lead to carrion, which is fungal abscess. So tinea pedis is in the foot. So usually it affects the sole of the foot as well as in between the toes and the finger webs. And you can see there the white patch. This is a typical feature of candida infection. It's a kind of fungal infection. And sometimes it can be mistaken by what? This can look like an eczema. This one can look like eczema. This one also can look like eczema. So why it looks like eczema? Because sometimes patients who come with fungal infection or tinea pedis, they have been using steroid cream. Therefore, the normal feature of tinea infection can be distorted, and that is what is called tinea incognito. So in this one, you're not sure whether this is fungal infection or eczema. So you may take history of atopy, any contact, sensitivity, allergy, because both are actually itchy. Eczema is itchy. Tinea infection is also itchy. So just like what I told you today, when you're not sure whether this is eczema or this is fungal infection, the best is you should do skin scraping and look at the hyphae. Look for the hyphae under the microscope. It's not difficult. It can be actually done in clinic kesihatan because what you need is just a microscope. Okay. But then if you're too lazy to do skin scraping, you can just try with antifungal first. And if it's not clearing up, then it could be eczema. So that's the trick basically. But for definitive diagnosis, you should send for skin scraping. Tinea infection of the nails, of the toenails and the fingernails is a bit difficult to treat. And it requires a long treatment. For example, if it's a fingernail infection, then you need 6 to 12 weeks, like 3 months. For toenails, can be up to 6 months. And the treatment usually is like a different than the normal one. I mean, different. Usually we use azole, like itraconazole, ketoconazole, for the treatment of fungal infection, oral. So local application of antifungal cream won't work for nail infection. So you need to use oral azole group of antifungal, or you can also use terbinafine. This is one option of treatment for nail infection. If you're using azole group such as itraconazole or ketoconazole, the treatment is actually interrupted. So you give in each month, you give 1 week. So 1 week you give itraconazole 200 milligram daily or BD, and then you break 3 weeks. And then on the 5th week, you give another 1 week course of itraconazole. So for between 3 to 6 months, depending of what type of infection it is. Remember, when you are treating fungal infection of the nails, please advise the patient that the nails which have been destructed by the fungal infection won't go back to normal. Okay, so the new growing nail is the one which is going to be normal. Because sometimes patients expect the disrupted nail can go back to normal, can be normalized. No, cannot. So they have to wait until all these infected nails grow out and replaced with the normal nail. Okay, so this is a typical feature of fungal infection of the nails. You can see separation of the nail from the underlying nail bed. So this is nail infection, fungal nail infection, which is a bit difficult to treat.